Today, we're going to pull back the curtain on something you probably never think about, but it's absolutely critical. We're talking about Turkey's healthcare system and a hidden crisis, how the country's biggest university hospitals are fighting a daily battle just to get the basic supplies they need to save lives.
So where does this all start? Well, it boils down to a fundamental conflict, a real tug-of-war that's happening inside every single one of these hospitals.
Think about it like this. Imagine one person trying to wear two completely different hats at the same time. On one hand, you've got the doctor's hat on. All that matters is your patient. They need something, and they need it right now. But then you have to switch to the administrator's hat, and suddenly you're asking, okay, but can we actually afford this, and what do the regulations say? This constant battle between care and cost is at the heart of everything.
And for university hospitals, well, this problem gets dialed up to 11. I mean, these places are doing it all. They're not just providing top-tier patient care, they're also training the next generation of doctors, they're running vital research, and they're the last stop for the most complex medical cases in the entire country. And all of that means they need more specialized and, you guessed it, way more expensive supplies.
Okay, so let's see how this internal tug-of-war explodes into a massive, system-wide crisis. And we're going to start with the cold, hard numbers.
Get a load of this number, 56 million Turkish lira. That's not revenue. That is the annual loss that just one hospital, Ankara University Hospital, takes on from treating just one category of rare disease. You heard that right, a loss. It's because the cost to actually treat these patients is so much higher than what the government pays them back for it.
And this strain isn't just about money. Oh no, it's a logistical nightmare. This number, 600, that was the peak number of little, inefficient sub-warehouses scattered all over just one hospital campus. Can you imagine trying to track your supplies in that kind of chaos? I mean, who has what? What's about to run out? It was practically impossible to know.
Now, to try and fix this, hospitals have a key state partner, the State Supply Office, or DMO. And on paper, the idea is solid, right? The government buys everything in bulk, gets better prices, and makes life easier for the hospitals. But in the real world, well, it's turned into a bit of a double-edged sword.
And here's why. Take a major hospital like Ankara University. It turns out the DMO could only supply about 38% of their medical needs. That leaves a massive 62% gap that the hospital has to scramble to fill all on its own. And that usually means going through more expensive private channels.
But you know what hospital managers say is the absolute worst part? It's not just the gap itself. It's the crippling uncertainty. Not knowing what's going to show up or when it's going to show up makes any kind of planning a total nightmare. As one manager put it, it's like trying to fill a gap that's constantly moving.
And this uncertainty creates these bizarre financial traps. So check this out. A hospital buys, say, an implant from one state agency, the DMO. But then another state agency, the Social Security Institution, or SGK, only pays them back a fraction of what it cost. For just one implant, that gap can mean a loss of 192,000 euro. The hospital is literally forced to just eat that cost.
So, faced with all these impossible challenges, what are these hospitals supposed to do? Just give up? No way! They rolled up their sleeves and started innovating from the inside out. Let's take a look at how they're actually fighting back.
Just look at this transformation. It's amazing. Cerrahpaşa University in Istanbul just went head-on at their logistics chaos. They got rid of nearly 300 of those scattered, tiny warehouses and replaced them with one enormous 4,000 square meter modern logistics center. Now everything is tracked, managed, and distributed intelligently from one central hub.
Akdeniz University took a different route, but it's just as brilliant. They leaned into data. They looked at what they were spending money on and realized some expensive tests were just being ordered out of habit. So you know what they did? They simply removed that test as a default option on the digital request form. That's it. And the result? A mind-blowing 78% drop in orders for that test. And get this, not a single doctor complained. That's a huge win for the budget with zero impact on patient care.
Then you have Ankara University, which found another powerful weapon: collaboration. Just by coordinating their big purchases with the Ministry of Health, they could tap into incredible buying power. And the difference is just, wow. Look at this chart. A device that would have cost the hospital 10 million lira to buy alone was purchased for just 2.8 million by working together.
Let that sink in for a second. That is a saving of over 7 million lira on a single purchase. And that's money that stays in the public budget, right? That's our money as taxpayers. It's such a simple idea, but it is so effective.
So what does all this tell us? When you see these incredible stories of resilience and creativity, what's the big lesson we should be taking away for the future of these amazing hospitals?
Well, one thing is crystal clear. These solutions aren't just bandages or quick fixes. They represent a deep, fundamental shift in mindset for how these institutions have to operate. They're innovating not just to get better, but to survive. And they're proving that the will to solve a problem can be way more powerful than the problem itself.
And that leaves all of us with a really big question. How do we, as a society, strike that delicate balance between cost, innovation, and of course, patient care? Because we really can't forget, these places are like medical fortresses, and their strength is ultimately the security blanket for all of our health.